Some mental health struggles are quiet. They don't always show up as dramatic breakdowns. Sometimes it's just not enjoying things you used to, waking up tired, no matter how much you sleep, feeling short-tempered, but not knowing why, forgetting things more often, feeling like everything is just a little harder than it should be. It's the invisible grief that comes with transitions, like changing roles, fertility challenges, relationship shifts, as well as aging. Women often carry these things alone because no one around them knows they're carrying it. So what does help look like? This part is important. Healing doesn't have to mean stopping your life or dropping everything. It can start with something as simple as saying, I don't feel like myself lately. Hey everyone, welcome back to Shriq Refai. I'm Shariq Refai, board-certified psychiatrist and the founder of Shriq MD. In episode 1, I shared why I started Shriq MD, and I told you stories of how depression hides in plain sight. In episode 2, we dove into the world of athletes and what mental health looks like behind the scenes with the silent pressures behind performance. Today, I want to talk about something I believe we don't talk about nearly enough: women's mental health. I've spent years listening to the stories of women who spent so much time holding it all together that by the time they come see me, they're exhausted, quietly overwhelmed, worn thin, and in a lot of cases, no one even knew. Women's mental health is different. Not better or worse, just different. It shifts across the lifespan, and it's influenced by things we don't always acknowledge enough. Hormonal changes, identity shifts, fertility, motherhood, menopause. It's not just about stress or sadness. It's about everything happening around a woman's life and inside her body, often all at once. And the truth is, it deserves more space. I once worked with a woman in her early 30s, smart, driven, deeply committed to her career and her family. She came in during what should have been an exciting time in her life. She had just had her first baby. But what she described was this strange disconnect. Not sadness exactly, not fear, just emptiness. She told me, I feel like I'm watching myself live someone else's life. There wasn't one big dramatic moment. No crying spells, no panic attacks, just a quiet erosion of herself. She wasn't broken. She wasn't failing as a new mom. She was dealing with postpartum mental health changes that were subtle but significant. And the reason she came in at all, her partner noticed she stopped laughing. That was it. Simple. There's phases in a woman's life, menstrual cycles, postpartum periods, perimenopause, where hormonal changes have very real effects on mood, cognition, and energy. Some women feel this monthly, others notice it after a birth. For some, it's in their 40s when things feel off, in a way they just can't describe. Take something like PMDD or premenstrual dysphoric disorder. It's more than moodiness or irritability. It can be a deeply disruptive cyclical pattern that affects relationships, work, sleep, and even a sense of self. And while some medications or birth control formulations can help, there isn't really a universal fix, and that can be frustrating for patients, and honestly, frustrating as a clinician too, because women I see often know something isn't right, but they've been told it's just part of being a woman, or worse, they start to question whether they're just overreacting. They're not. Many women, especially mothers, caregivers, professionals, are used to pushing through. They're used to multitasking, making things work, doing for others before doing for themselves. I once had a patient who worked full-time, cared for 3 kids, and handled everything at home. She told me she kept thinking, other women are doing all this and more. So what's wrong with me? That question right there, that's the weight of it. It's not just mental health symptoms. It's shame around having them. Women are incredibly good at blending in with their responsibilities. Even when they're struggling, they still show up, still deliver, still smile. But inside, they're afraid. And the hardest part? No one ever taught them that they were allowed to ask for more. Not just from others, but for themselves. Some mental health struggles are quiet. They don't always show up as dramatic breakdowns. Sometimes it's just not enjoying things you used to, waking up tired, no matter how much you sleep, feeling short-tempered, but not knowing why, forgetting things more often, feeling like everything is just a little harder than it should be. And sometimes It's the invisible grief that comes with transitions, like changing roles, fertility challenges, relationship shifts, as well as aging. Women often carry these things alone because no one around them knows they're carrying it. So what does help look like? This part is important. Healing doesn't have to mean stopping your life or dropping everything. It can start with something as simple as saying, I don't feel like myself lately. It can be a short conversation, a journal entry, an honest moment with someone you trust. Sometimes therapy helps. Sometimes medication helps. Sometimes just getting permission to put yourself on your own priority list helps. It doesn't need to be dramatic. It just needs to start. I've seen patients begin to feel better after the smallest steps, just sleeping better, or speaking more kindly to themselves, or letting go of one unrealistic expectation. They start to feel like themselves again. Not some perfect version of themselves, just more whole. This episode is important because I've seen too many women carry too much for too long. They don't want pity. They don't need a motivational quote. They just need someone to say, hey, what you're feeling is real, and it matters. Whether you're dealing with hormonal mood swings, burnout, or just that quiet feeling that you're not quite okay, this is your reminder that you don't have to figure it out alone. If you've been walking around with that heaviness, whatever it looks like, I hope this episode makes you feel seen, or maybe it helps you see someone else in a new light, a partner, a friend, a sister, a mother. Because women's mental health isn't a niche topic. It's part of a human experience, and it deserves more honest conversations like this one. Thanks for spending this time with me on Shrink Wrapped. If anything here resonated with you, feel free to share it with someone you trust. And if you're not sure what the next step is, that's okay. You don't have to have all the answers. Take one small step for yourself and maybe talk to someone, or reach out to me at ShrinkMD. As always, let's keep this conversation going.